Many patients are told that increased pain after acupuncture is a healing reaction. But is it? When pain appears after treatment, is it a normal therapeutic process? Or is it something we should try to prevent? The medical literature does acknowledge that post-needling soreness can occur. Large safety studies report that mild discomfort may follow treatment, with reported incidence between 2 and 11%. Most cases resolve within 24 to 48 hours. So, yes, this phenomenon exists. But statistical occurrence does not automatically mean clinical ideal. High level practice aims not to explain reactions, but to anticipate and minimize them. From a physiological perspective, several mechanisms have been proposed. Needle insertion produces microscopic tissue stimulation. This may initiate a localized inflammatory response. The qi sensations involve peripheral nerve activation and local biochemical signaling. Molecules such as ATP and adenosine may participate in this process. These are measurable biological processes. They are not mystical events. But understanding the mechanism raises another question. If we understand how it happens, should we simply accept it? Or should we try to prevent it? I do not deny that mild temporary soreness may occur in some situations. But what deserves closer attention is predictability. When pain significantly increases, it often suggests that stimulation has exceeded tissue tolerance. Treatment should aim to regulate physiology, not create additional inflammatory burden. In patients with central sensitization, strong stimulation can amplify pain processing. This is neurophysiology, not simply chi stagnation. So the real question becomes, how much stimulation can the system actually tolerate? I prefer to think about this in terms of system capacity. Every patient has a different capacity to absorb stimulation. If stimulation remains within that capacity, the system usually integrates the signal and moves toward regulation. But when stimulation exceeds that capacity, the system may respond with pain, fatigue, or stress reactions. This is not necessarily a healing crisis. More often, it reflects a dosage mismatch. Clinical skill is not only about technique, it is also about calibrating stimulation to the system's capacity. calibration is clinical maturity. Different conditions also carry different risks. For non-pain conditions, significant post-needling pain should be unusual. For mechanical pain disorders, mild localized soreness may occasionally occur. For patients with central sensitization, stimulation often needs to be significantly lighter. Disease mechanism shapes the system's risk structure. The central issue is not whether reactions occur. The central issue is whether we predicted them. Predictive assessment requires structured evaluation. Sleep quality, anxiety level, chronic pain history, current inflammatory load. Technical calibration also matters. Intensity, retention time, number of points, tissue readiness. Common contributors to post-needling pain include excessive manipulation, overly strong electroacupuncture, too many needles, prolonged retention, deep insertion without tissue readiness, or poor positioning causing muscle guarding. These are not accusations, they are calibration variables. Because dosage without assessment is guesswork. The literature acknowledges that reactions can occur. Clinical responsibility is to reduce and predict them. If a reaction occurs outside our anticipation, it signals an opportunity for refinement. Mature practice is not defined by explaining reactions. It is defined by reducing preventable ones. That is the responsibility of clinical decision making. Thank you for your thoughtful attention.